Hey guys, good afternoon. Hope all is well. Simone here from Best Version of You Weight Loss and Wellness. I want to do a video today. I'm actually calling this video Did You Know? So I'm just going to go through some things. You probably know about it. If you know, you know. If you didn't know, now you know. So I'm just going to list like 3 to 5 things and just educate you a little bit on them. The first thing I wanted to talk about was, did you know that women, we're born with all our eggs. When we're born with all our eggs. Guys, they make sperm throughout their lifespan, but us women, we're born with all our eggs. So at age 30, we have about 10% of our eggs left, because we go through like our menstrual cycles, right? And every month we lose thousands of eggs just by going through our menstrual cycles. By age 40, we have about 3% of our eggs left. That's the first did you know. Number 2 is, did you know there are estrogen receptors throughout her whole body? So that's why when we're going through like perimenopause and menopause and losing estrogen, this is why we have symptoms all throughout our body. So like, for example, right, we have like the brain fog, which is what a lot of people report, a lot of brain fog, fatigue, tired, headache. That's why there's an increased risk for cardiovascular disease. That's why there's an increased risk for osteoporosis, because we lose muscle mass while going through menopause. So that's why, a lot of people in their 60s and 70s, when they fall, even though when it's not a bad fall, they tend to break something, their hips, something. So that's, basically estrogen receptors are throughout our entire body. So when we lose estrogen, it have an effect on basically our entire body. Next, did you know that estrogen act as an anti-inflammatory? Yep, it does. So that's why throughout our hormone deficiency period, a lot of people will complain of frozen shoulder, a lot of muscle aches, body aches. I have this one lady actually came in. She's been on hormones since she's been in her 40s, throughout her premenopause or perimenopause, her menopause, and postmenopause. She's 69 years old. She actually came off of hormone maybe like 6 months ago, and she came back in and she was like, you got to put me back on it, because she was like, again, I'm having like just the aches and pain and body aches and some other symptoms of postmenopause, such as like vaginal dryness and itching and all of that. So I put her back on. So she's doing well. All right. Next, did you know that women in their 40s and 50s, mostly premenopause or perimenopause and menopausal, have an increased risk? Studies show there's increased risk of 3 things during this age cycle between 40s and 50s: suicide, leaving their jobs, and divorce. Suicide, because a big thing with going through hormone deficiency is mood disorder. So a lot of people will complain of anxiety, depression, even ADHD and bipolar. So a lot of people who have been on like antidepressant, anti-anxiety for many years will say like it's not working anymore, and it's basically not the antidepressant, and their psych doctor or primary doctor will increase the medication when they really need to look at their hormones. So it's really the hormone deficiency that is causing the mood disorder. So a lot of it shows increased risk. Study shows increased risk for suicide. Leaving their job comes down to, a lot of women go through like brain fog. So they don't remember things, or things when it comes to their work, or the way they used to do their work, or, they don't remember. They have brain fog, fatigue. So a lot of women leave their job during their 40s and 50s. It shows an increase in, this at this age. It also shows an increased risk of divorce, because a lot of women as well, because they're going through this and this change in their body, it kind of have an effect on the relationship. So I have one lady who's in her 40s who reached out to me, who is going through perimenopause. And this was her exact words: please help me, because my husband's going to leave me, because if he look at me or touch me, I want to bite his head off. So she's going through like, just mood disorder, just anxious, something is going on with her body, and she's trying to figure it out. And she kind of, kind of take it out on her husband because of what she's going through. So that was her exact word before she signed up with my clinic and started on hormone replacement. So yeah, and the last one I'm going to go through is so did you know that a lot of postmenopausal women, because postmenopausal could last for several years, right? Menopause usually, full-blown menopause usually start in your early 50s, but you could have postmenopausal symptoms in your 60s, 70s, even sometimes 80s. So a lot of women go through their menopause and not requiring any medication, even though they're struggling with it. And when they reach their 60s, they're like, I can't deal with these symptoms, because sometimes the symptoms is even worse when you're going through postmenopause. You know, you have like the pain, you know, every day wake up with muscle ache, pain. You have the vaginal itching, the vaginal intercourse is painful, or painful intercourse, I should say. The vaginal itching, the vaginal dryness. So a lot of women will come to me in their 60s, and you know, they're going through postmenopause at this stage, and they're like, I can't deal with it anymore. But a lot of providers, once they see you, you know, in your 60s going through postmenopause, they are very skeptical about initiating hormone therapy, because it's been, if you're in your 60s, it's been over 10 years since you've been going through menopause. And studies show, even though most of these studies are on synthetic hormones and we're treating you with natural hormones, still studies show that there's more increased risk of things happening if you initiate someone on hormone therapy after 10 years of menopause. So if you, like my lady that I was talking about, she's 69, but she's been on hormone throughout her whole premenopause, menopause, and postmenopause period. So, you know, for her to start hormone again,